hearts are for patients. Just a little bit about myself. I'm a full-blown ADD, ADHD patient, and I was typically the patient that would come home with those little notes where the teachers would just beg the parents to just start putting the patients on Ritalin and Concerta, Strattera, all these central nervous system stimulants. And my mom just decided to start praying, and the other 50%, which God didn't remove, she just loved it out of me from behind. So from a medical point of view, I am really a typical, neurotypical, highly functional ADD patient. And that's why I've got this very specific passion for functional medicine, integrative medicine. I could have gone to study neurosurgery, I could have done neurology, I could have done orthopedic surgery, but the Lord led me to go and specialize in functional medicine, integrative medicine, biomedical therapies, all the other modalities that we'll see in the presentation. And that path led me to stem cell therapy in Singapore in 2011. So from 2007, I started doing the functional medicine anti-aging fellowship. And in 2011, the Lord took me to Singapore with one of my leukemia patients. And we landed up learning and integrating with the Singapore and Russians quite a bit on the latest frontiers of stem cell therapy. So for the last 10 years, I've been doing stem cell therapy full steam, 100% on a week-to-week basis. And I'm very proud to say that I've passed my 10,000 hours in the last 10 years with regards to stem cell therapy, in combination with patient therapies and webinars and seminars and courses attended, and a real fellowship degree that we've completed. So I'm very, very passionate about this topic. If we go and look, that's just Dr. Tapiwa trying to just give a little bit about myself. So yes, I am currently the president of the American Academy for Orthopedic Medicine. So sports medicine is my basic qualification. So I'm a medical doctor. Then I went on to do a sports physician fellowship, and that got me to do the PRP, the biomedical therapies, and to some degree also the stem cell therapy. So that's just our contribution from a regenerative point of view, academic wise. Partnerships with University of Pretoria and Potchefstroom, where we do most of our genetic and DNA analysis, and where we do most of our settings whenever we do engage into research and clinical studies. So those are the two partners there. And as Dr. Tapiwa is rightfully putting down here, the world is changing at a rapid pace. If we look at since the Second World War, what's happened to the amount of plastic compounds that's hit our water systems, that's hit our economic food chain, that's hit our agriculture, the amount of pesticides that's just being poured into the soil, we can just see that the top layer, the top soil layer is starting to diminish and starting to really just disappear and fade away. And the amount of concentration of pesticides in that lowering topsoil is starting to really accumulate and affecting our children and our patients in a very negative way. Then once we ingest the food, either fruit or either dairy products or whatever products we consume, I've tasted potato, sweet potato, I've tasted strawberries and apples and oranges, sent them off to the universities, asked them for a proper biochemical analysis. And in some of those vegetables, those seemingly innocent vegetables that land up on our dinner plates, we really see up to 17 highly concentrated pesticides still in its original form in the fleshy part of vegetables coming from agriculture. So that got me thinking and saying, listen, we need to really dig into our patients' detoxification filters and systems to see if we are able to cope with this amount of plastic compounds, with this amount of pesticides and toxins being just dumped into our water and food systems. And lo and behold, we discovered that we are not really geared for this bombardment of toxins and pesticides and heavy metals and everything being thrown our way. Also, since the 1950s, penicillin was discovered very recently only, and just the amount of antibiotics that we've seen exponentially being developed in the last 40 years. Not even discussing the resistance patterns of all the organisms, how quickly the bacterial organisms and the viruses can really start to beat the defense mechanisms and change and adapt their defense mechanisms to overcome the antibiotic or the antiviral that's being presented to them on a frequent basis. So we are really on our last frontier of antibiotic therapy, which is vancomycin. Some of the parents really know vancomycin well, because it's just one of those wonder drugs that can get a very resistant Staph aureus or whatever out of the upper airways and nasal passages. But vancomycin is technically and truly our last hope. So the French and the Israelis are really speeding ahead to try and develop new antibiotics and strains, and we are running out of ideas. That's the basic of it. And that's why, from a functional point of view, I've decided to really just take a step back from chemistry, take a step back from pharmacology, and just look at what God's given us in nature, just a little bit less harmful, just a little bit slower in action perhaps, but not nearly as compounding in our bodies as we find these chemical structures to be. Team member, good morning everyone. I'm a STEM mate. Mom, message me if you need any assistance. Thank you, team member, logging in there. So we're really at the last frontier of antibiotic therapy. And you know, us in Africa particularly, we're still being viewed as a third world continent. And even though we have third world systems in place, I believe we really have first world and kick-ass therapies that we can offer our patients. So from a medical point of view, I really believe that we are with our foot in a first world tier, first world system, but we have some third world support structures and resources. So I don't truly believe we're still third world continent, but that's where the world places us, and that just puts us on a little bit of a back foot, because we do not get the best of vaccines, we do not get the best of medication, we do not get authentic medication. So I really feel sometimes Africa is being left as the little black kitten in the white litter, just really trying to survive. And we've been really given not experimental drugs, but we've really been giving generic drugs that's not as effective as it should be, as the real authentic original mother molecule. So that's just from a chemical point of view. So yes, a lot of genetic modification in foods. So we have decided to really just go into a whole new tier, not look at acute care medicine as much, which Africa is very, very good at. Probably one of the leading countries in the world when it comes to emergency medicine and acute care medicine. But I don't think we're really good at preventive medicine and really looking and dissecting into a patient's biochemistry, analyzing bloods properly, looking at genetic material, DNA analysis, really looking where gene mutations have crept in, really interpreting those with the functional approach on the patient. So functional medicine doctor takes a patient and the patient family. We make you guys the gatekeepers and the center of the decision-making system, and we just feed information and steer the family unit in a specific direction. So I think from a personalized point of view, we really practice personalized medicine. So very few of my patients, and even if the moms, on the webinar today, you'd agree that not one of your patients or not one of your kids really share the same supplement basket, share the same. There are basic baseline few ones that we really need just from a inflammation and the immune system point of view, but we really try to individualize the baskets for the patients based on the unique biochemical footprints, the genetic material, the mutations that we find when we do the DNA analysis. So from a medical point of view, I think there's really room for keeping the family at the center of decision making. You moms are absolutely so innovative and creative, and you can really dig into and research a topic well. So I really love when the moms come with the stacks of papers and they just inform me a little bit on new trials and clinical trials and new drugs on the frontier. So I really enjoy your input as well. Looking at medical examinations and investigations, what happens when your child or when your family member actually arrives in South Africa and meets the team? So we obviously sit and we do introductory interviews and consultations. We do full functional assessments from occupational point of view, speech therapy, physical therapies, and as well as medical examination. We complete PET scans, PET CT scans, MRI scans, whatever is applicable. And I mean, I believe even in the webinar profile today, we have some patients just battling with straight good old osteoarthritis. So if you come with your knee or a shoulder or a spine that's busy degenerating, then we send you for an MRI scan, or if you come with your MRI scan, we do a proper interpretation, give you a second or a third opinion, and we can really, with our therapies, we can really start regenerating any system that's busy showing decline and showing degeneration. So, compilation of results and treatments. So we have to prepare these bodies for the ultimate intervention, which all of you will probably agree on all your research, on all the groups and the webinars that you've attended, that regenerative medicine and stem cell therapy in particular is probably singled out as the more effective solution for the patients at this stage. You know, looking at just a pain point of view, so chronic pain medication, anti-inflammatories and all the rest just don't seem to change the disease, does it? I mean, it doesn't modify the joint, it doesn't modify the ligament, it doesn't modify the inflammation spot or anything. It just numbs out and blocks out that pain pathway. So what we do is we really get the body well prepared. If I get a body that's full of inflammation, if I drop stem cell therapy or biomedical therapies into that body, then the cells and the medication is going to zoom in on the area of significant inflammation first and foremost. So if we prepare the body well, we get all the inflammation systemically well regulated and down with regards to diet, with regards to some IVs. We've got a beautiful IV lounge and an IV bar menu that we select from to really prepare the receipt and the recipient of stem cells in any case. So the IVs, the supplements, the diet, the preparation of a patient before interventional therapy like stem cells or cell-based therapies or biomedical therapy, in my view, is really what turns the corner for the patient and what really gets the stem cells to just focus and zoom in on the targeted area, albeit the brain in autism or CP in the spinal cord, or if we look at the stroke victim, or if we look at Duchenne's muscular dystrophy, if we look at any autoimmune disease, the patient really gets the benefit of the cells and the therapy zooming in on the area of inflammation and not just being diluted into the body if the body is not well prepared. Therefore, we take a little bit of a more functional approach on preparing the patients before we do the great interventional procedure. So what is functional medicine? So we've just realized that in the last 20 years that diet has played quite a huge role. So I've started out the webinar saying the topsoil layer is diminishing, the amount of pesticides and concentrations are increasing, and what we're seeing that food plays a tremendous role. So we don't have grains in the world, I think more than 3% anymore that's really truly organic. So all the seed and grain are genetically modified. So what does that mean? So it means that the seed is technically seedless. So once that seed is used up, you won't get a replication or a harvest anymore. So typically in the old days, 10, 15, even 30 years ago, we would put one pip in the ground, one seed in the ground, and we would get a couple of trees or plants coming up. Now these days, you put those plants back in the soil. If it's got the IP, intellectual property on the seed, depending on which country manufactures them, you won't be able to allow to grow except for own use. But I mean, you won't be allowed to grow a crop to sell on as fresh produce because they've trademarked all the seeds and everything. So from a scientific point of view, it really leaves us with a very tweaked, very toxic, very inflamed bowl of grain that we really have to digest. So we prefer gluten-free. That's what the GFC of diet stands for, gluten-free and casein-free, so dairy products. So gluten and dairy makes up a huge part of neuroinflammation. And I know a whole 80-85% of patients and family members looking on today are being confronted with neurological conditions predominantly. So from a gluten and a dairy point of view, those are neuroinflammation bombs. So if you have a patient or a family member, or if you are a patient really consuming gluten and dairy on a daily basis, I would recommend that you get in touch with Andeline or Dr. Tapiwa or one of the team members or me to really delve into the details of your meal plan, because the meal plans really are what keeps the maintenance road going. So after the interventional pathway, we do cells or stem cells or biomedical therapy, maintenance really relies on a healthy lifestyle. And part of that healthy lifestyle choices make up your gluten-free, dairy-free diet program. So why is this? So if you just look at gluten, I mean, we live in Africa. So Africans all know the black mamba, right? We all know the mfezi, the cobra, the spitting cobra. So all of those, the black widow spider, the one with that orange and little red hourglass figure on the tummy at the bottom of them. So we are all very familiar with very venomous animals in Africa and on this continent. And those three that I've just mentioned, the mamba, the cobra, and the black widow spider, they all carry neurotoxic venoms. And that's part of the toxin profile. So if we look at gluten and we look at those toxic venoms that I've just mentioned, the neurotoxins, take them to the laboratory and we extrapolate all those individual strands, we see that gluten and one of the proteins in neurotoxic venom almost look like cousins. And therefore, from a functional point of view, I go back to gut work and gut function, and we start seeing now that gluten also reacts as one of those neurotoxic molecules in the body, starting first and foremost in the gut, causing a lot of autoimmune disease, autoimmune activity, a lot of inflammation in the body. And on top of that, it's a neurotoxin, which means it predominantly affects our central nervous system. So does that sound like a good idea for someone battling with a neurological condition? I don't quite think so. So gluten is a real big inflammation bomb. Then just looking at dairy from a practical point of view, I've never seen a baby ever being born after breastfeeding on his or her mom, then getting off the breast and then really going to other mammals in nature that God has created and going to take of their milk. So we're the only mammal that God has created that actually does this bizarre action. So from a medical point of view, it doesn't make sense. From a moral point of view, we don't find it in nature. You don't see a baby goat going to suck on a baby calf or cow, whatever, after they finish with breastfeeding. Once we finish with breastfeeding, we go on to solid foods, and that's generally how mammals are supposed to live. So this supreme mammal is supposed to be the human race, going back from breast milk and going back onto another mammal's milk. We do not have the biology or the biochemistry or the enzymes in our digestive tract to really digest other mammalian milk. So I know it's a big challenge, especially in Africa where food resources are very scarce, but I do think from a medical point of view, it makes sense to really keep it as rich and authentic as possible. So what type of dairy would I recommend? I would recommend fresh, full cream, highly perishable. That means the milk that goes off in one day, not the one that's cool in the fridge for 2 weeks, and certainly not the one in the box that you can keep in the pantry for 6 months and then open up and it tastes as if the milk was extracted the previous day. So it just doesn't make sense. The amount of preservatives, the amount of hormones, the amount of antibiotics that they put in dairy products to keep up a shelf life just doesn't make sense in a patient battling with a neurological condition. So I really urge you to just try this out, and maybe I would go for 4 weeks and just try a 4-week window where you go gluten-free and maybe still a bit of dairy, and then you go 4 weeks dairy-free, maybe reintroducing gluten a bit, and then you see on which of those exclusions and molecules your family members or you really respond worse or better to. So, but science have showed us and research has showed us that gluten and dairy really just delay any rehabilitation with regards to functional medicine. Looking at stem cells, I believe this is what most parents always want to hear. I mean, it's a huge developing field of regeneration and repair and cell renewal and organ renewal. And, you know, one of our mentors in the book has done multiple clinical studies. They have really done a lot of research for us, put it out there. The guys in Panama have done tremendous amount of high quality research. The guys in Israel and Jordan, high quality neurological research studies that's really being put out there, and you can find them in high impact journals. If you're really interested in reading some of the research of the professors out there, you're welcome to contact me or the team members personally, and we can forward you these research, because it's really great, high impact journals with really good outcomes. So what are stem cells? Stem cells are the basic primary cell in your body to really give your body the best second chance. So it's got the ability to renew almost any cell in the body. So some stem cells have the ability to renew any cell in the body. So if we look at what type of stem cells we get, the two major discrepancies that we find is in the embryonic field of medicine and then in the adult stem cell field. So I want to categorically state that we do not condone or use or utilize any embryonic stem cells in our practices at all. Just from a moral, ethical point of view, it's just not where we're supposed to be looking at. We carry cells in our own body, which is called autologous stem cells. We carry them in dental pulp, you know, in the pulp of the tooth, and we carry them in bone marrow. So currently we use three sources to get stem cells from, of which bone marrow and fat is obviously the most abundant in the body, and of which we've seen in neurological conditions that both are safe and effective to use. So both fat-derived and bone marrow aspiration-derived cells are really safe, really effective for neurological conditions, albeit if we administer the stem cells intravenously or intrathecally or even directly into injured tissue, if it's a knee, a ligament, a bone, a cartilage, or a musculoskeletal condition. So we support so these are just all the positive chemicals and growth factors that the stem cells release and facilitate and recruit into the area it's being injected into. So once we inject it, say for instance, into a muscle or a joint, or we inject it into the veins, these are the growth factors that are really being liberated and really being released as positive chemicals to go and cause positive reactions in the local tissue and also positive reactions further down the stream. So they recruit from other sources in the body, and they have a local effect. So it's two very distinct characteristics of stem cells. So they have a local effect and they have a systemic effect that recruits growth factors and chemicals and neurotransmitters from elsewhere in our bodies. And typically what we see, and why the big fuss about stem cells, it's one of the really true generals in the body that can improve blood supply to a specific organ system or a specific injured area. So if we look at this, the capillary there on the left of your screen, starting to have that little sprouting bud, then you've got this huge new vascularization bed that develops, and then it settles into a mature network of blood supply in a couple of months. And this we generally see within 6 to 18 months. You see that third step where there's a proper mature network of new blood supply to that organ or organ structure or injured tissue, you know, that we try to recruit new blood supply. So that's the true basis of the first function of stem cells. Second one is specifically, that one is just the types of stem cells, embryonic, umbilical cord, and adult stem cells. This is the one we use. And then the other function of stem cells in the body is obviously a huge amount to do with the way it regulates and manages inflammation in the organ system or in an injured area or injured tissue. So looking at a stem cell, you've got this beautiful new blood supply coming into the organ system, and you've got this regulation of inflammation that is being down-regulated. Another third one that I just want to mention to the moms and the dads who's maybe had the privilege of doing some genetic profiling on your kids and maybe DNA analysis on yourself. So once you get to the panels where you see the mutations, the glitches on the genes in the DNA information and reports that you receive from whichever lab you do the analysis at, you will find that stem cells have the ability to do gene silencing. That means if it's a very, very bad glitch or very deleterious health mutation that you see on that gene profile and gene panel, stem cells have the ability to go in and silence that gene effect in your body. It doesn't switch it off. You can't undo genetic material. That's a recipe that's fixed in the body, but we can control and manipulate the way that the body responds to the signals coming from a mutated gene. So that's a very, very, and there's a lot of research on it, but it's a very new finding on stem cell therapy specifically, that it's got this ability to have some gene silencing effects. And that's probably where the research will go to in the future. I know a couple of countries already in the realm, in the area of gene manipulation, gene deletion, genes insertions, specifically pertaining to patients with cardiovascular disease, high blood pressure. So there's high blood pressure gene that can be deleted or can be manipulated. So I mean, the scientists are really doing awesome work everywhere in the world, around the globe. There's real great labs doing really great work, and I always look at looking at the results whenever they publish. So conditions that we consider safe for stem cell therapy at this point in time, that's in either in research phase already, in clinical trial phase already, past clinical trial phase. From a neurological point of view, autoimmune disease, so autism spectrum disease, including Asperger's, which has now been included into the autism component, ADHD or ADD, cerebral palsy, spinal cord injury. Great article I read 2 weeks ago on the new advances in spinal cord injuries, with great results and outcomes, where you can really see levels that are being recruited on a spinal cord injury. And patients with spinal cord injuries or families with any quadriplegics or paraplegic patients will tell you even gaining one level could be life-changing. I had a patient, I'll never forget it, she was in a car accident and she had a specific fracture as the car overturned, and she had a very specific level of injury, so she couldn't feel it if ever she wanted to void or go to the bathroom. And by doing stem cell therapy, we managed to actually regain 2 levels on the spinal cord injury. And it was an old injury, so it was past 2 years, and we were able to regain 2 levels. And today she doesn't have the problem she used to have in a wheelchair, going to a mall, going to a sport match with children, and being embarrassed by having a little accident with number 1 or 2 because she didn't have that sensation. So visceral sensation is returned, and we've restored some dignity, we've restored some quality of life for her, and she's one of our very happy patients living here in Pretoria, just very close to us. Multiple sclerosis, great research coming through on autoimmune disease and the way stem cell therapy and cell-based therapies are specifically addressing the effects of MS. Muscular dystrophy, I mean, it's one of the default treatments, I believe, in 2021 for patients battling with Duchenne's dystrophy or muscular dystrophies, is to go for cell-based therapies. Just, the best option to really switch off any autoimmune disease, to get those genes very quiet and very silent while we're busy recruiting new blood supply, new nerve supply, and really improving the central nervous system from a dystrophy point of view. Dementia, intellectual disability, stroke is, I mean, we've had such awesome stories on stroke patients in the last 7 years. Autoimmune neuropathy, CIDP. ALS is still a tricky one. I mean, it's out there, it's heavy being researched now, and stem cells play a significant part in ALS, but I haven't yet seen a great outcome with regards to cure, but I've seen a great outcome with regards to quality of life from stem cells for patients with ALS. And definitely life extension is possible for them. So from a quality of life point of view, yes. From a disease modification point of view, I'm yet to see some high quality articles being published. Parkinson's, we know Parkinson's is really at the forefront of research. We've got Harvard, we've got Mayo Clinic, we've got all the great universities around the world really doing collaborative efforts to get Parkinson's, give it a good hiding. So I think we've got great research coming through there, great clinical trials being completed now, and we see great clinical outcomes for Parkinson's patients. Scleroderma, myasthenia gravis. So those are just the neurological conditions currently, and you'll see that list growing as research continues. Coming to orthopedic conditions, so from an orthopedic medicine point of view, I want to categorically state, and I'm very happy to state that the FDA has officially approved stem cell therapy for orthopedic conditions. So not all orthopedic conditions, but at least the FDA is right out in the media now really proclaiming that stem cells are one of the first new tier and first line therapies for orthopedic conditions. So watch this space, a lot of development coming around the world from this particular. I'm just very privileged to be on the panel that where we have these discussions on with the FDA directors, with the FDA scientists, with the universities and all the rest, really pushing the envelope, really presenting good, high quality research with regards to orthopedic injuries. So watch this space. There's a lot happening in the stem cell arena and orthopedic conditions. So that one has been now in 2021 being approved by FDA as being an FDA approved condition for stem cells. Looking at systemic conditions, so diabetes, I mean, it's a huge disease burden on every country wherever diabetes is, and we just see great results. I mean, my best personal experience with a diabetic patient, he was a type 1 diabetic patient, high doses, over 100 units of insulin, that he was injecting himself for over 30 years with many, many side effects and complications, obviously, from that. And he was so well prepared with our IV protocols, with our diet. He was very compliant with regards to lifestyle changes, and we did the stem cell protocol and cell-based protocols and biomedical therapies to follow. And I'm very happy to say it's 8 years later, and a type 1 diabetic patient is still insulin-free to this day with absolutely 100% normal blood glucose. So that was, and he was a young guy, he was probably 50. So, not an old patient, which probably counted in our favor for great result and outcome. But there is hope, and there's a great, great amount of research coming through from a diabetic point of view with regards autoimmune activity, inflammation, and then just restoring those beta cells in the pancreas specifically for diabetes, just giving them some hope and a quality of life again. Post myocardial infarction, that's the good old heart-fashioned heart attack. So we see a lot of cardiologists, interventional cardiologists with their cath labs, really giving cell-based therapies a go. And whenever they inject the stem cells in the infarcted area, around the infarcted area with myocytes cultured from a patient's own stem cells, we really see great results on functional repair on that area that was oxygen deprived and that was starved of oxygen where the heart attack occurred. So also great results, and I think they already passed the research stage there. So I think in the States and especially in Panama and on the islands, it's definitely in full swing on therapeutic practices. Asthma lung disease, so I mean, most of you understand anatomy a little bit, will know that once a substance has been introduced intravenously, we call it the first pass effect. And that's just the way that the oxygen, poor blood flows back to the liver, the lungs, and the heart to be oxygenated and then to be pumped back into the systemic circulation. We know that whenever you inject a bolus of any medication or cells or antibiotic, you get a first pass effect with the cells or the medication reaching the lungs and the heart and the brain on the first pass. So the lung acts as a specific bed and network, almost like a mesh, trapping those cells. So any patient battling with a chronic lung condition, interstitial lung disease, COPD, emphysema, asthma, anything to do with the autoimmune or degenerative condition or inflammatory condition of the upper airways, I can tell you now that cell-based therapies are one of the ways to go when chronic, especially when a chronic pathway sets in. It's just a natural pathway. The cells flow back to the lungs, get stuck in the lungs, the heart, and the brain is the first pass effect. So those three organ systems obviously get the biggest attraction of a bolus of intravenous stem cells. So any patient battling with a chronic lung disease, this is certainly one of the interventions you may consider. Male and female sexual dysfunction. So one of my mentors and friends, Dr. Charles Runnels, has done great work in getting rid of male and female sexual dysfunction by making use of cell-based therapies. So he's even coined some words, which I don't know if it's okay on this platform to mention, but maybe we can do a dedicated sexual talk one day just for sexual dysfunction with regards to people battling with painful intercourse. If patients battle with erectile dysfunction, patients battling reaching orgasms. So I mean, they are really, this is something close to every person and every couple's heart. If there's a sexual dysfunction due to cancer or prostate issues or surgery issues or surgical issues because of gynecological procedures, then it's really something close to a couple's heart, and it's just restoring intimacy for that couple. It's a special part of what we do. So sexual dysfunction is definitely a very big field of therapy for stem cells. Beauty therapy, stem cell facelift. So I was the first doctor in South Africa, and Africa for that matter, to introduce the stem cell facelift. And I must say we've got a lot of happy customers walking out there just with rejuvenated complexions and brightened complexions and healthy looking skin, good quality looking skin, new collagen being produced, and they just really love the procedure. So the stem cell facelift procedure is generally a once off. I've only had one patient ever coming back for a second procedure, and that was in year 7 after she had her first procedure. So I don't think that's a bad strike rate in repeating it in 7 years, and just because she had a little bit of disposable income left on that year, she decided to spoil herself on her birthday for a second round. So generally the beauty therapy and the beauty industry really love cell-based therapies and interventions there. So we do vampire facials, vampire facelifts. That's where we use the growth factors derived from a blood draw to really just rejuvenate the skin and repair. And obviously, if you just look at more medical condition, looking at skin, looking at burn wounds, and looking at chronic wounds with wound care clinics and all the rest, I think it's really a very medical way, very practical way that you can treat the patient at bedside with their own cells, and really facilitating, ensuring that there's new blood supply, new nerve supply, and just the best optimal end result for the patient, a fully functional skin barrier that can really protect and keep bugs out. 3 stages of the process. So this is now what happens when your kids or you enter with us into theatre. And I know a lot of doctors here don't really like to share what we do in theatre, in the lab. I mean, there are some proprietary information and some IP going around, but in general, you go with us into the operation theatre. We do either a lipoaspiration or we do a bone marrow aspiration draw. So we put in tiny little needles into the bone marrow or just under the skin if we do lipoaspiration, and we withdraw bone marrow and the right amount of fat cells and lipoaspirates to liberate the stem cells that we need for this specific procedure. Stem cells are then separated in a very highly specialized lab by highly specialized personnel. I do most of the procedures myself still, just because we have the capacity and we've got really efficient staff in the lab that can assist me. So I'm in the lab with every patient, just making sure that the cell counts are being done. You need to know what the dose of stem cells is that's being injected back into your body. Any doctor just injecting stem cells back into your body and he can't tell you the amount of cells that you are receiving, I would put a bit of a question mark there. So that's all part of quality control to make sure that you actually did liberate the stem cell component and how many stem cells am I being injected with. So I think that's something that, establishes trust with the patient, and that just distinguishes us from, some of the practices out there. So if they can't give you cell counts and they can't tell you that it was confirmed stem cells and mononuclear cells, I would put a question mark on the type of bolus or cells that you are getting. If you do improve, then obviously you're lucky that there are stem cells in there, but it's just always very reassuring to know that I am getting my own stem cells injected back into me, and that the lab and the team and the doc, then at least know how many cells are being injected. So the stem cell implantation has been done back into theatre again. We take you back into theatre for a second procedure. That's just part of our sterile protocol, where we don't want to compromise our patients at all, and we do not certainly want to compromise the stem cell draw that was done. Because if those cells are contaminated and you put them back into the central nervous system or into an area, then infection might be more likely. So we really try to keep it squeaky clean, very sterile for patient comfort and for just that reassurance that your cells are in good hands and in a clean environment. There's just me doing a bone marrow aspiration on one of our patients, and the illustration there is just to show how deep we actually do put that needle and drill in to obtain the best optimal draw. And this also follows the protocol. Once we've given you the 2 injections to stimulate and liberate more granulocytes and stem cells from your bone marrow, we really get great yields, and we get great draws, great concentrations, great cell counts if we do this technique specifically. Then it's taken to the lab, and we just separate the cells with a centrifuge technique, gravitational process. So that's why the FDA allows this to be done from a bone marrow point of view, specifically for orthopedic conditions, and that they've given their blessing now, because it's just, if you put it into a centrifuge, you just enhance and facilitate the whole gravitational draw of cells, because the stem cells and the cells separate overnight in a specific fashion in any case. So the centrifuge just expedites this process, and that's why it's such a favorable treatment according to the FDA. Stem cell implantation, that's us just putting it back into the area that's needed and that's been assessed. In this illustration, it's into the central nervous system with the intrathecal injection, and those would typically be then for autism patients, ADHD, ADD, cerebral palsy, stroke victims, and autoimmune disease. Stem cell implant also intravenously or intramuscular, depending on the underlying condition. And there's just some techniques where we show in which area. So obviously, if you've got a nurse injecting you with stem cells, then I would also put a specific question mark on it. This is done by trained medical doctors. It's got to be registered medical doctors at a minimum as a point of departure, just to keep the technique really on good standard and good quality, and just to know that your cells are being placed at the right position with image guidance. So we use x-rays, we use ultrasounds to confirm that our cells are being placed at the right side. It's no good you've got a ligament injury and I just inject the stem cells into your muscle belly and it doesn't get injected into the right area. So delivering the cells at the right area with image guidance, I think, is just one of the standards that we've established to really distinguish a high quality service that we offer you. There's just an illustration of cells being reimplanted into joints. So, I mean, that can be done blindly, as on the picture on the left. We, however, use ultrasounds and x-rays just to confirm that the needle placement is perfect onto the structure that's been diagnosed as carrying the injury, and we just want to give you the best result and best outcome possible. After room recovery, obviously, you will have a little bit of side effects. So at the site where we've done the withdrawal of stem cells, you might have a little bit of inflammation, with the biggest complication there being infection around the site where we've drawn. So obviously, we do give a patient a specific antibiotic as a once-off, not to interfere with the treatment and the therapy in the cells, but just to make sure that there's not a little skin bug that wants to keep us busy over the weekend after the procedure. So you might land up with a little bit of a headache, loss of appetite, a little bit of nausea. We have a couple of patients that actually do have bouts of vomiting, which is also normal, but it's been monitored by our trained staff to know exactly what signs to look out for. We do see that there's loss of appetite. In some of the patients, we do see that some of the patients present with low-grade fevers, which are also still fine. And please, if a patient is returned back home immediately and you don't join the rehabilitation unit with Dr. Tapiwa and his team, please make sure that you do not give your patients anti-inflammatories to break a low-grade fever. So we have a very strict protocol. We know NSAIDs or non-steroidal anti-inflammatories or steroids are to be used 2 weeks after the procedure, as it just diminishes the effect of the stem cells in the area being injected. So we've got a specific discharge protocol for pain and fever after the procedure, and then obviously the antibiotics just for prevention. And then obviously observations are also being done. The brain PET scan before and after stem cell therapy. So here I have to salute the general in the Asians in India, Dr. Alok Sharma. I mean, he has done thousands and thousands and thousands of scans for all of us to see that no matter what the condition, what the underlying diagnosis, whenever you introduce stem cells into a patient's central nervous system, you always have the effect of an improved and an increased blood supply. So we do this. So the PET CT scan, just for you that are not familiar with this is a very functional scan that's been done, and it's determined by the uptake of a very specific glucose molecule, a sugar molecule, in the brain area to assess blood flow in that area. So Dr. Alok has shown us that there is not one scan that's been done in the world in his unit that has not shown an improvement in blood supply in the area that was previously seen as having low blood supply. So the glucose uptake is always higher after stem cell therapy. So that for him and the research that he's done over the past 20 years, sir, I salute you. This is just the introduction on the facility that we currently use in South Africa, and it's called Birchmed Surgical Centre, a nice, squeaky clean little 30-bed private day clinic owned by a couple of our doctors, and we are very, very happy to say that we haven't had a COVID patient or a positive COVID case yet. And I mean, it's been 14, 15 months down the journey with this whole COVID devil that's been let loose in the system. And there you can just have a look at what the wards typically look like. We do have private wards as well. If the patients are really restless or if the family prefers that the patient's being isolated, we really have those special eye care units as well. That's just me on the far right, just doing a fecal transplant on a patient with a very, very resistant type of gut dysbiosis, and fecal transplantation for specifically Clostridia difficile is really one of the mainstay treatments of which we offer for patients with gut dysbiosis. So once the gut is recharged and repaired, and the reset button is pushed by just the implantation of healthy bacteria, you just see a great improvement in patients, especially patients battling with speech deficit. Therapies that then follow, and very important after the stem cell therapy. Now we've done the first step in the protocol. We've given you or your child the stem cell therapy, and these are the therapies that we do offer as ongoing support, especially 7 days after the stem cell transplant. But certainly, if you book into our rehabilitation facility, you will have access to all these therapies listed below, including hyperbaric oxygen therapies, ozone, occupational therapy. And we don't do occupational therapy on just a basic note. We really do have ABA trained therapists, in the team that really give your child the best outcome, just the best result. Yielding the best outcomes for the patients and the family as a whole. So you can see we've got psychology, speech therapy, special education teacher with us in the unit. We do stick and maintain a high standard on the diet and the meal plan, which the children will definitely be evidence of. Reflexology and massage, magnetic stimulation, and then low light laser therapy specifically for those waves to improve immune systems and to really just improve oxygen in the blood for the brain. So these intensive therapies, we do recommend that in between the 2 stem cell treatment bouts, so day 1 and then in month 6, that you really get your kids or yourself into a center like this, where you're really being exposed to trained high quality staff and make sure that the period before and in between the 6-month periods that you really get good quality neuro rehabilitation. There's just a picture of one of our patients in the ozone chamber on the right, and there's the hyperbaric unit on the left. Great to just think of oxygen being introduced into the area that generally suffers with less oxygen. So we always see an improvement. The improvement in some patients are well, and are some patients noticeable, but not that not that great from a subjective point of view. But you always have a scorecard that you work on based on that initial assessment, that you can track the progress. So whenever your child is subject to oxygen, there will always be an improvement, and you can take that from me as a rule of thumb. And it's one of my gold standards after stem cell therapy, even a sports patient with a sports injury, to get into a hyperbaric oxygen chamber. I just think it makes all the sense in the world to enrich any area whatsoever with super oxygen. Benefits: you get increased tissue repair, oxygenation in the areas that's been deemed hypoxic or in low oxygen supply, and that just improves recovery in general. So there's just some benefits that Dr. Tapiwa has listed for us, just on what it does. So for the scientific moms out there, you can certainly look at what's being done in the hyperbaric oxygen chamber. And then I can tell you now, from the Hyperbaric Oxygen Association in America, we get a lot of good quality research and clinical studies coming through. So Dr. David Rosignol, he's our president at the MAPS organization, the Medical Academy for Pediatric Special Needs, and he's a huge stern supporter of HPOT or HPOT as it goes around in the circle of patients. So I think from a medical point of view, just makes all the sense in the world. There's just the magnetic stimulation bed at the center, non-invasive, and there's a very specific impulse and a very specific frequency that's being released in the body and for the brain to facilitate healing in specific areas. Photobiomodulation, so this is low light laser therapy, and we place that specifically on the head as we want the effect to be central nervous system. The frontal plate and the frontal bone and sinus is a very thin plate, and those light rays and all the rest can really penetrate and affect that frontal lobe or wherever the light is being placed. So that's just a picture of us just administering some laser therapy for a patient. So it shows huge effect on the mitochondria. So those are the little energy supplying units in the cells, where it just affects the mitochondria on a positive tone, and this is where the energy of the cell is being stored and created. Nutritional and dietary supplements. So this is just for all the moms and the patients out there. I haven't had my morning shot yet, so this is just to show you what a typical morning shot of a functional medicine doctor's tablet look like. So I mean, this is all natural ones, all of them, and the little white one here is just for my hair. So that's the only chemical one I take. I've got this fear of losing my hair, so I just want to have a full head of hair when the Lord Jesus comes back again one day. So I just take one chemical tablet, and all these other ones are just little immune support, vitamin D, zinc, omega-3, krill oil, all the ones that we take from a functional point of view. There's the homocysteine lowering formula just to keep the inflammation in bay. So this is what your doctor's breakfast looks like in the morning as well. So from a diet and a supplement point of view, it makes all the sense to know which manufacturer you are supporting, which brand you are supporting. If you've got brands or access to high quality brands, you don't always have to go and buy the most expensive product, but they generally come with certificates of quality, which makes a huge difference. So for instance, if you take a omega supplement, so this omega capsule is 1,000 milligrams. Okay, looks like a normal, innocent little looking omega-3, but in some of these omegas you find off the shelf, you will see 30% of the content is actually just omega-3. The rest is all just sunflower oil or omega-9s or pro-inflammatory oils, vitamin E or all the rest, just to use as fillers. Only 30% of most of the tablets out there are omega-3. This is a high potency one of the ones that I'll be prescribing your kids and you if you join our center. And this one at least is 90% omega-3, high potency. That's why we call it triple strength. And the other 10% is vitamin E as a stabilizer and a preservative. So it really makes a difference to know your brand. And if you're uncertain if it's a high quality or good quality brand, please reach out to one of our team members, Dr. Tapiwa or me, and we can inform you how to interpret a label and just to make sure that you know what the dose is that you are getting on the supplements. So vitamin D, I mean, if you look at vitamin D and neurodegeneration, so the universities in South Africa has gone back into time, and all the brain tissue that were donated for research over the last 50 years, they've gone back to establish what the vitamin D level was for conditions like Parkinson's, dementia, Alzheimer's, MS, stroke patients, all the tissues that were donated for research. And we have discovered not inconclusive, a conclusive thread that low vitamin D levels are one of the common denominators on all four main neurodegenerative conditions. So it is an indirect indicator of what your neuroregeneration or neurodegeneration status is. So get to know your vitamin D level with a blood draw at the local pathology lab, and send them on to us, and we can show you and teach you how to optimize your vitamin D. So from a medical point of view, it makes all the sense in the world. Omega-3 fatty acids, so this helps with brain health because it's a natural anti-inflammatory, it's a natural antioxidant for your brain. So this is what your kids will be put on whenever they join the center and they're being introduced into nutritional supplementation. So we refer to this as nutraceuticals. So nutraceuticals, but in a pharmaceutical fashion, because we give high potency, good quality, high dose therapies on these supplements. And the B complexes, so if you look at your B vitamins, and this is where the moms who've done those DNA analysis and those genetic mutation screens, you've seen that your child can either activate B vitamins or they can't. So they either have the enzymes to switch on and activate and make the B vitamins absorbable, or they don't. And if they do have it, then we're very fortunate always, and we give them just a normal baseline B complex to help with cell repair and methylation. That's a specific name for cell and brain repair in the body, methylation. But if you lack the enzyme to activate the B vitamin, then for instance, you can get folic acid, and folic acid in your body will be weed out in the urine as folic acid. If you do have the enzyme to convert this, folic acid will become folate in the body. So we just distinguish between the patients with enzyme challenges and enzyme mutations as to which one to really you put in your nutraceutical basket. So that is functional medicine and supplements. Looking at CBD oil, so what a great surge of research we've seen and launch of products and people manufacturing, for Pete's sake. I even have a farm in Lesotho where we're doing CBD now. So in growing CBD, and we got the licenses, we're doing great research with overseas and a Nigerian professor. So we've got an Israeli and a Nigerian professor really just giving us high quality research. So even I have ventured into CBD, and we'll be putting out our own product pretty soon. But the research is looking very promising, and the quality that we get in the lab is absolutely of the purest quality I've seen in the last 7 years since I got involved with CBD. So just a little bit on the note on this. So CBD is the molecule that we're really after. There are specific subtypes of CBD. So, I mean, I don't want to get too technical or too analytical, but CBD is the substance you're looking for. So if you do get your hands on a product and it's not certified CBD only, then be quite careful, because the THC is the molecule that you need probably 0.02 or 0.0 something % of to just activate the CBD receptor, and then the CBD can go and lock onto the receptor on the cell. But if you carry a high concentration of THC in your substance, you're going to get a very psychoactive response. And some patients, and this is something you don't know, Some patients are just highly resistant to the molecules and they can tolerate a lot more, which leads to substance abuse. And some of them are so sensitive. I remember in my 5th year med school, we had a 5th year med school friend with us. And the one night they were sitting and doing all these little experiments on weed and cookies and all the rest. And those were the years when it was still illegal in South Africa. And our friend literally became schizophrenic in one night on just one joint that was obviously in a high concentration of THC. So we didn't know in 94 that, you know, we could establish these mutation pattern on enzymes and all the rest. We didn't know that he had this specific glitch. And the patient is still in one of our institutions, mental institutions, here in Pretoria, never finished med school. I mean, he's estranged from his family because he became acutely schizophrenic on one joint. So you really need to make sure that CBD is pure and CBD is certified to be pure in that product. If they cannot produce a certificate of analysis, and if they're not prepared to give you the certificate of concentration and manufacturing, I wouldn't even consider the product. So that's just on a personal note. But do we use and prescribe CBD in our practice? Often. Then this is just a little introduction and some pictures of our beautiful young ones at the center. This is Dr. Tapiwa's center, and here you can see education, intense education. You can see it's a family unit. You can see it's a friendly environment. So we really get a lot of support from local communities, and we also really invest a lot into the center, me from a personal point of view, just to see the kids getting the best benefit. So our therapists are really, they've got a heart for your children. They've got a heart for kids. Dr. Tapi was passionate about development and just getting the patients to the best level of functioning that they can get them to. This is just part of the team and how they interact in the classes and how they go on excursions and just how they progress in general. There's a little view on the outside of the center, so you can see it's a real friendly, homey environment in a very safe, secure rehab center. So your child is safe here, and I can tell you now that the staff there really love the kids. That's just another angle on the view. Really beautiful, serene, green grass, beautiful palm trees, typically what the rooms look like. So it's really high quality. The meals are included. So it's really just a fresh new outlook on personalized rehabilitation. So I really love the center. Then we're just looking at I think we're coming to the close or the end of this. Yes, we are. So from a medical point of view, from a parent's point of view, from a patient point of view, so I am a special needs patient, first and foremost. I'm a medical doctor, trained in biomedical therapies and stem cells, so I really have a great passion for this, and it's only to give you the best benefit, your child, your precious one, the best benefit. We currently are only using Dr. Alok's protocol, so for you, those of you who just want to know what type of protocol we are using in theatre, only Dr. Alok's protocol, based on his research and outcomes, we're getting those same outcomes. So from a reassurance point of view, you know that at least it's been tried, it's been tested. We have his blessing. I had the privilege of meeting him in Pietermaritzburg when he did a talk here 2-3 years ago. So really, really just a practical protocol that gives the patients the best outcome. So that's what we do. I keep in touch with the guys in Panama, in Cayman Islands. I keep in touch with Israel. I keep in touch with Singapore and Jordan. So we are really, at the forefront of stem cell therapy in the world. So if you have any questions, if Tapiwa and Aline, I don't know if this is time for maybe just some questions for the parents or something. I see there is a little public chat and a drop-down block on the outside there. So I'm going to allow for a couple of questions. Maybe you want to engage, or maybe you just want to supply an email address where they can reach us and they can send us some Q&As, but I'm definitely available, say, for the next 30 minutes or so if you just want to do some questions and answers. Segofatso, that's a pleasure, my friend. That's a pleasure. So I'm only here. So I always believe in knowledge is power, you know. So if you get the best knowledge available, if it's being presented to you plainly, not too technical, I always believe that the patient's parents can make the best informed decision as to where to send your child. I mean, I know how we love our children, how you love your kids, and you know, this whole COVID thing is a big scare for all of us. And just to know that you've got a center that's a little bit closer, that's on the continent, you know, that's reputable, that you can trust, and you know, the guys are accessible. So from a medical point of view, I do think that the more information we share, the better the informed decision you make as to where to send your child to. So Tshegofatso, that's a pleasure. Pauline, my pleasure. Thank you for giving all of us an hour of your day. I know weekends are special and precious for family time and all the rest, so thank you for your time in just logging in and just getting informed. So obviously, if there's a specific condition you want to inquire about, I do think that we've addressed all the conditions that we're very comfortable in treating. There are some outlying conditions and outliers that we also treat, so feel free to ask about those. If we haven't specifically mentioned the condition that your family is being challenged with, I'm very happy to reply. So I see some people are typing and then they delete, and I see some of you are logging off. Okay, so Dr. Tapiwa has just given the nudge that we can close the webinar and stop the webinar. So please feel free. You see the email there at the bottom. You see all the cell phone numbers. Please reach out to us, Annalene, Dr. Tapiwa, or myself. One of the team members are standing by to take a call or take a question. So thank you very much for joining in. Thank you for your time that you investing into your child and into your family member just to get some more information. And please feel free to send us any email on a one-on-one basis. I'm very happy to answer those. Okay, so God bless you guys. We love you, and we just want to give the best to your kids and your family members. So please reach out to us. Annalene and Tapiwa and I are here for you. Okay, all the best. Have a great weekend.